Hello. This DVD's been made to help you understand all the information you might need before considering whether or not to join FOCUS4. It's meant to add to the information you've already had from your oncologist or research nurse, and of course the patient information sheet. We know it might all seem a bit complicated at first, so you should take as much time as you need to make your decision and replay any parts that are not clear. You might like to view the DVD with family members or friends and discuss things with them. Watching it might also make you think about other questions you need to ask your doctor or nurse before making a decision. Remember, whatever you decide about taking part in FOCUS4, the quality of the care you receive will not be affected. FOCUS4 is a clinical trial with several studies within it. The trial is looking at a number of different treatments for patients with bowel cancer that can't be removed by surgery or which are spread to other parts of the body. The way we make progress in treating cancer is by doing clinical trials. Let's hear from Dr. Richard Adams why FOCUS4 is so important.
FOCUS4 has set a new benchmark really in terms of how we do colorectal cancer trials, but also has evolved from other cancer types and trial designs, and it's taken the information from those trials and it's taken it to the next step. And that next step is about trying to, again, tailor specific new treatments in as early a stage of the treatment of metastatic or incurable cancer as possible, trying to bring those treatments to the patients that we scientifically believe are the most likely to gain a benefit from those treatments.
There are various types of bowel cancer. It all depends on the molecules that make up the cancer cells. To find out what these are, scientists use specialist laboratory tests to examine the cancer cells in detail. First, they look for some of the genes that are often changed in bowel cancer. All cells, the good ones and the abnormal ones, have genes in them made up of DNA. DNA contains the instructions for building proteins that control all the cells that make up the body. You could think of your genes as a sort of instruction manual, telling cells how to grow and what to do. In some types of bowel cancer, the genes start providing the wrong set of instructions, and these lead to the faulty growth and behaviour that's found in bowel cancer. Some of the genes that interest us most in FOCUS4 are called BRAF, PIK3CA and RAS, but other genes might be looked at as well. If any laboratory tests show that the bowel cancer cells contain these genes, then it's possible that some new drugs might be more helpful for one type of bowel cancer than another. In FOCUS4, a number of these new drugs will be tested. I asked the lead doctor, Professor Tim Morn, to explain a bit more why he thinks FOCUS4 and the way it's designed is so interesting.
I think there are three reasons why it's really important and innovative. The first is that we are testing treatments that are geared or tailored to the individual's cancer, rather than one treatment for everybody, subgroups with specific treatments geared for that subgroup. The second is that we are testing those treatments very early in the course of the disease. So just an initial 4 months of standard therapy and then straight into looking at what the novel treatment can do. And the third is that we can adapt the trial as we go along, so that if we find a treatment isn't working, we can drop it. But if there's something new that's coming up, we can bring it in. We can change the way we subgroup the patients. So it's adaptive, and we can therefore mean that it will constantly stay up to date.
So, laboratory tests will show if your type of bowel cancer has changes to certain genes. Then we'll use these results to work out which part of FOCUS4 might be suitable for you to consider.